Welcome to Qiological Shop Talk. In this podcast, we bring you roughly 20 to 25 minutes of practical clinical methods, perspectives, and advice that has its work boots on. Listen in for clinical gems that you can begin to investigate the next time that you walk into clinic. Additionally, visit the show notes page for supporting materials from this week's guest on Shop Talk. All right, friends, roll up your sleeves. Let's get to work. This episode of Shop Talk is brought to you by Lhasa OMS, your clinic's partner in wellness. Later in the show, listen for a special offer from Lhasa to help you with all the transitions your patients face. The information shared on this podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified licensed healthcare professional before making any decisions about your health or treatment. The host and guests are not responsible for any actions taken based on the content of this podcast.
Hello, my name's Rebecca Avern and I'm a paediatric acupuncturist in the UK. I want to talk today about the importance in clinic of not confusing behaviour with pathology. And specifically in relation to this, I want to talk about the concept of yin fire in children. When you study paediatric acupuncture, one of the first things you learn is the distinction between excess sh children and deficient shu children. You will learn that deficient children tend to be pale, quiet, have slender bodies, need a bit more rest, that they may be perhaps more clingy, and that excess children tend to be robust and have ruddy red cheeks, lots of energy, strong, intense emotional reactions, and are not afraid to assert themselves in the world. In clinic, as is so often the case, the distinction is not often that clear-cut. And actually, this distinction really increasingly feels like it doesn't fit what we see in children in clinic in the West in the 21st century. I am increasingly seeing children who, at first glance, appear to be excess children, but who are actually deficient children. More specifically, their behaviour leans towards that of an excess child. They're full of energy, they're boisterous, perhaps even a bit hyperactive. But the other signs and symptoms that we see are all suggestive of deficiency. They're pale, they're thin, they don't eat much, and everything gets worse when they're tired. So what is going on here and how can we make sense of it? Well, the way that I think we can very much make sense of it and therefore treat these children in the way that they need and really bring about change in them is to look at Li Dong-yuan's concept of yin fire. Li Dong-yuan first discussed this concept in the Wei Lun, which he wrote in 1249. Let's look at what this concept of yin fire is. It's essentially a pathology that stems from a deficiency of both spleen qi and yuan qi. One of the roles of yuan qi in particular is to hold the minister fire in place, in its place of concealment, in the lower burner. When yuan qi is weak, the minister fire then escapes from its place of concealment, rises up, weakens the spleen in the middle burner, and goes upwards to the upper burner where it tends to harass the heart and the pericardium. So immediately when you hear this concept of yin fire, you hopefully can see why so many children are appearing excess in their behaviour, because they have this pathological fire harassing the heart, but that it stems from a deficiency which explains the rest of their signs and symptoms. And this pathology can also come about not only from the spleen being weak, but also from the kidneys being weak. So when kidney yin specifically is insufficient, the kidneys are not able to effectively control the minister fire, which is then further stoked by the heat that arises from the yin deficiency and again rises upwards pathologically and harasses the heart and the pericardium. So it's the rising up of the fire disturbing the shen that causes the behaviour, and it's the deficiency in the yuan qi, in the spleen and or kidneys that causes the other deficient signs and symptoms. So why is yin fire so common in children today? Well, there are many, many aspects of 21st century life that lead to the formation of this pattern. For example, we tend to have children later than we did, which may lead to there being more chance of children having deficient yuan qi. Generally, children have very overscheduled lives and a very intense emotional environment. Interestingly, Li Dong-yuan also said joy, anger, worry, and fright weaken the yuan qi. And those emotions that he mentioned are quite yang emotions. It's striking that he didn't mention more yin emotions such as grief and sadness. And it's these yang emotions that children are particularly prone to and have this agitating effect, furthering that tendency for the minister fire to rise upwards. There are also many other factors in life which tend towards children's spleen becoming more and more deficient. Some of these factors occur in pregnancy. For example, the use of cold medications, lack of rest, lack of appropriate support and nourishment for the mother, or birth factors, the use of cold medications such as antibiotics and anaesthetics during labour. And then after birth, there are even more factors which can negatively impact on the spleen of the child. A poor, cold diet, lots of empty calories, lots of snacking, excessive consumption of cold and raw food, the tendency for children to do a lot of mental work from a young age, and generally living in an age of information overload. And it's the spleen that does a lot of the work of having to process and transform all of this information. And then children may have either too much or not enough exercise. And children, for example, of divorced parents, spleen may be further impaired by the fact that they're moving around between different houses during the week. And then there are lots of aspects of life which increase the tendency of the minister fire to become pathological and rise up. The intense and prolonged emotions that we've already mentioned, generally living a very overstimulated lifestyle with lots of cognitive activities. And yes, we can't avoid mentioning screen time and excessive screen use in children. And the minister fire is only healthy when it remains in the lower burner. It is said that it should be level and calm. And all of these factors of life will increase its tendency to rise upwards and become anything other than level and calm. So, yin fire essentially describes a situation where there is heat above and cold below, or excess above and deficiency below. And we can readily see this in children who may feel hot in their head, but their belly is cold, or their feet are cold. So, the next question, and the most important one, of course, is what do we do about it? The way to successfully treat yin fire is to strengthen the root, to supplement the spleen and the kidneys and the yuan qi. When the spleen and the kidneys and the yuan qi become stronger, they then effectively keep the minister fire in its place of concealment, and it no longer pathologically rises upwards and harasses the shen. So during the course of treatment, we see that children begin to become calmer, they sleep better, their behaviour becomes more manageable, more conducive to good relationships and the ability to pay attention and have focus. Very often we see their appetite increase, so they're more able to supplement their postnatal qi from diet rather than from drawing too heavily on the qi of those around them. So we need to be very mindful when we see a child whose behaviour may on the surface look like it comes from an excess full pathology, to see whether actually it comes from this condition of yin fire. And the appropriate treatment principle, when that is the case, is to strengthen the root. And of course, we should always remember that in children, less really is more. We need to do simple treatments and use points that strengthen the root and help to bring qi downwards. Points such as Ren 4, Stomach 36, Kidney 1, which we can use just with moxa. We don't need to needle it. And we would also need to give appropriate lifestyle advice and work with the family to try and lessen any elements of the child's life which are prolonging this tendency to yin fire. So when we successfully treat yin fire, we not only help the child to feel better, and obviously that has huge impacts on every other aspect of their life, but we're also lessening the chances of the child growing up to develop chronic inflammatory autoimmune type conditions. The reason that Sun Simiao said that there is no greater Tao than the Tao of nurturing the young is because when we treat a child, we're also treating the adult who they are to become. And it's much easier to eradicate these pathologies in childhood, where the qi and the zhang fu and the organs are not yet fully formed or set, than it is in the latter stages of life. So it's really important to be aware of yin fire, not to jump to the conclusion that a hyperactive or even disruptive child necessarily has a full pathology, but to be mindful that this behaviour is just the manifestation of a deficient root. I hope you find that useful. I have lots of other aspects of paediatrics to share with you, which can all be found at www.paediatric-acupuncture.com, or do look at the show notes below the podcast. And thank you for listening.
When you're looking for herbs, tools, and supplies to guide your patients through life's transitions, you need quality you can trust. Lhasa OMS offers an unmatched selection of acupuncture needles for every style, herbs from all your favorite manufacturers, and everything else you need to run your clinic with confidence. Visit LhasaOMS.com to source the herbs and other supplies featured in this series. Use the code FERTILE15 for 15% off your next purchase at LhasaOMS.com. Some exclusions apply. See website for details. That's it for this episode of Shop Talk. Did you learn something that brought a patient to mind? Don't keep a good thing to yourself. Share it with a friend. They'll be happy that you did. And tune in again for our next episode of Shop Talk.